Hello my dear students and welcome back to Excellence Batch with your Diksha ma'am. Here we have started a very wonderful important chapter from every point of view, whether it is NEET, whether it is your boards or CUET, any exam. So why not to do it very well? So in the previous lectures we have discussed about the reproductive health problems and strategies. And in the second lecture, again the previous one, we have also discussed the population explosion. It's time to discuss something that can control the population. And what is that? That is contraceptive methods, the methods of birth control. So you hear me right? We are going to study the methods of birth control, also known as contraceptive methods. Also known as contraceptive methods. So these are the methods that can prevent the unwanted pregnancy. Sometimes people actually do not know what these methods are and they do unprotected sexual intercourse and they end up having a baby. They didn't want it and they end up having a baby, and that is known as unwanted pregnancy. So we can prevent all those unwanted pregnancy by using all these methods. Okay. So what are contraceptive methods? As we have discussed, the contraceptive methods are birth control methods. Contraceptive methods are also known as birth control methods. They prevent unwanted pregnancy. They prevent unwanted pregnancy. So they come with various forms, right? There are various contraceptive methods. They come in different forms. Some are natural method, some are like in the form of tablets, pills, some are in the form of some devices like condoms. So there are various varieties, various options. What option fits you well, fits the couple well, that couple can choose it, right? But one thing the ideal contraceptive should have is, if I say this contraceptive is the ideal contraceptive, what should be its characteristic features? Or we can say the best contraceptive. The best contraceptive method should be first of all effective. If it is not effective, it's not working good, it will be of no use. You are using it to prevent pregnancy, and if you end up having pregnancy, what's the use of it? No use. So first of all, it should be effective. Second, it should have least side effects. If you are using it, whether you are a male or you are a female, if you are using it, then your body should not get any harm. Your body should not get any harm, it should not have any side effect. For example, if females are having pills, if they are steroidal, might be steroidal pill in long term may get some side effects, right? So to a female's body, if it is giving side effect, it is useless. So this is the second important point. Third is, it should not be expensive. If it is very expensive, people will not be able to afford. You know, which countries have a lot of population? India and China. Let's talk about India. In India, we have more population that is below poverty line, right? People who are like either they are middle class or they are below poverty line. So these people, they cannot afford very expensive contraceptive methods. For them, if it is like 1 rupee or 2 rupee, they can easily afford it, right? So they should be very cheap, they should be less expensive so that everyone can use it. They will not get an excuse, yeah, it's expensive, will not use it, okay? So almost if you will see any country which have a lot of population, they have one thing also, that is poverty, right? Another thing is that these contraceptive method, they should be easily available. Easily available. That means you don't have to find, oh, where should I find it? You just go to chemist, over the counter, you can get it very easily, right? So that's easily available. If doctor makes a protocol, first you have to go to that government department, then this department, then this department, then the person will think, I will not use it, let it be, right? So it should be very easily available, everyone should know where to get it. Another point is it should be reversible. For example, if today a couple start taking the contraceptive or start using the contraceptive, at or during the usage time, it will be effective. It will prevent the pregnancy, right? But as soon as they quit using it, they stop using it, it will not affect their fertility. They can have a baby again. So somehow it should be reversible. Once you quit using it, the body should get back to normal again. A person should not get sterile or infertile. So that is what reversible is. For example, if a female is having pills for a month, for that month she will not be able to conceive or have a baby because she is using contraceptive method. If she quit using the contraceptive for next month she can have a baby. That is what reversible is. You can come back to your original position where were you, right? So if all these things are there in a contraceptive, it is an effective contraceptive method, right? One more point, if it is there, then maybe the contraceptive is the best. Along with these, that is, it could prevent STDs. This is like additional point, okay? Just like you get something free and you feel it nice, right? You went to buy a chocolate and somehow there is an offer and you find out with chocolate another chocolate is free, so you will like it, no? Just like that, if any contraceptive have all these points, but along with that it have this point also, it can prevent sexually transmitted disease, then you will find it best, right? So if any contraceptive have all these most of these character, it's an ideal contraceptive, okay? This one is a gift point. Even if it is not there, you will not say it's not an ideal contraceptive. If it is there, yeah, it is good, okay? All right. So the first method that we are going to discuss is natural method. So natural method is a kind of method where you are not using anything. You are not using any devices, you are not using any pills, tablets, it's just naturally happening. It's just naturally happening. You are not using anything from external, right? Like I am not eating any tablet, I am not using any materialistic things also, nothing. We are just making it happen naturally. We are preventing the conception naturally. How? Let's see. So a natural method, no devices or aids, it's not the AIDS, HIV AIDS, AIDS means devices, okay, or pills are used. If nothing is used, it is kind of a, you know, the method where it's like hit and trial method. So if it is like hit and trial method, you are not using anything from external, it is the least reliable method. That means the failure rate will be more failure rate. It will have more failure rate. Another thing, it will not prevent STDs. If I am saying it's a hit and trial method, like in Hindi we say tukka maar lete hain, right? So that hit and trial method is never successful. Okay, so natural method is just hit and trial method. It is never like 100% successful. It has the most failure rate. It is least reliable. That means if someone is following this method, be ready for a surprise. Okay. All right. So the first in this case is periodic abstinence. Periodic abstinence. Right. So periodic abstinence. Abstinence means not practicing. Abstinence means not practicing. So what we see here, we see the menstrual cycle of a woman. You all know this is how a menstrual cycle of a woman is. This is day 1, this is day 5 of menstruation, 14 of ovulation and 29 the end of the cycle. At 14th day, ovulation occurs, right? Here egg is released and the chances of pregnancy is highest at 14th day of a menstrual cycle. Let's take an example. On 1st September, female got her periods. So that means around 14th September, she must be ovulating. It's not pretty sure on 14 she'll be ovulating. She may ovulate on 13, 12, 11, even on 9. She may be ovulating even after 14, 15, 16 and 17, but there is a bracket that in the mid of a cycle between day 10 to 17, female will ovulate if her cycles are regular. If her cycles are regular, she will definitely ovulate in the mid of the cycle, right? So, in the mid of the cycle is around 14th day. We can't take a risk. What if female ovulate on 13th day? There can be a chance. So, what we do in periodic abstinence, if we know that on 14th day female will ovulate and there are highest chances of pregnancy, so a couple can abstain or a couple can stop doing sexual intercourse on the mid of the cycle or during the mid of the cycle. But again, as I've told you, it's not sure that every time on 14th only, exactly on 14 ovulation will take place. You never know. So, we always take a bracket of 10 to 17 day. Imagine this is the 10th day of the menstrual cycle, this is 17th day. So, 10 to 17 day of a menstrual cycle, any time ovulation can take place, and highest chances of pregnancy are always on the 14th day. Right. So, on 10 to 17 day of menstrual cycle, if a couple stop doing sexual intercourse, imagine she had periods on 1st September. If a couple stop doing sexual intercourse from 10 September to 17 September, the chances, again I am saying, the chances of having baby will be less. Okay. But again, chances, there may be a chance they start doing it on 18th and on 18 ovulation took place, right. So, that is why these are not reliable. And second thing in this method is a female should have an accurate menstrual cycle. A female should have an accurate menstrual cycle. Imagine she have irregular menstrual cycle. Sometimes she have a cycle of 30 days, some months she have for 35, some months she have for 45. There are more chances she will get the surprise. Okay. So, you know what surprise is? Baby, right? Eureka, baby is there. So, what is periodic abstinence? It means not practicing the sexual intercourse. I am writing it completely, not practicing the sexual intercourse around day 10 to 17 of menstrual cycle during ovulation. And what is one thing that we definitely need in this cycle? We need regularity of menstrual cycle. If a female does not have a regularity of menstrual cycle, I think the couple should not use this method as a reliable method as a contraception if they don't need a baby, right? There are other methods also, we'll talk about them. So, in the natural, this was the first method, that is a periodic abstinence. Let's talk about the other one. Second method. Second method is coitus interruptus. What is coitus? Coitus is the another name for sexual intercourse. Coitus is the another name for sexual intercourse, right? So, what happened during sexual intercourse? The penis goes inside its vagina, and in vagina the penis ejaculates, release semen inside the female's vagina, and that semen contains sperm. So, what if male does not ejaculate? Male will do the entire sexual intercourse, but the male will not ejaculate inside the vagina. That means he will not deposit the semen inside vagina. Then the chances of pregnancy will be less because the semen has not been deposited in the vagina, right? There are no sperm. But again, failure rate is higher. Now, what's the issue in this? Because in male, before ejaculation, during sexual intercourse, before ejaculation also, a fluid is released, and it is said that might be that fluid may contain some sperms, right? That's a pre-seminal fluid. That means the fluid that is released before ejaculation. So that fluid can also contain some amount of sperm, which can be problematic and a couple can have a surprise. Okay. So here what's the deal in the coitus interruptus? The penis is withdrawn or it is taken out. The penis is withdrawn, or let's write just taken out for a simple word, is taken out from vagina just before ejaculation to prevent insemination. What is insemination? You all know now, because we have done this in human reproduction, to prevent insemination. Okay, but what's the side effect? Let's see. The pre-seminal fluid. What is pre-seminal fluid? Fluid that comes before ejaculation may contain sperms. May contain sperm. So these two natural methods that we have done so far, first, in first case, female's menstrual regularity was very important. We just see ovulation time and do not perform sexual intercourse. In this one, the male will take out the penis before ejaculation so that he will not deposit semen inside female's vagina. But what's the side effect here? The pre-seminal fluid might contain some sperm. Okay. Now third method in the natural. Third method in the natural is lactational amenorrhea. What is lactational amenorrhea? Amenorrhea means no menses. Amenorrhea means no menses. And when does female have no menses? First, when she has not hit the puberty, that means menstrual cycle has not started. Second, when she has hit the menopause, that means the ovarian follicles are empty, she is around 50 years of age and there are no menses. And second time in between that, she get no menses when she just have a baby. After delivery, the female is on lactation, that means she is producing milk. So that period of lactation, around 6 months actually, 6 months is a period of intense lactation where she produces milk maximally. After that it reduces. Okay. So in that period of intense lactation, she does not have menses or menstruation cycle is at halt, right. So that lactation period where no menses are happening, this can also lead to the failure, right. So usually couple think, oh, it's lactation period, no menses is there, we can perform the sexual intercourse without precaution. But again, surprise, how? Let's see. Anterior pituitary of a female during lactation, which pituitary? Anterior pituitary. During lactation produces a hormone prolactin which helps in milk production. During first 6 months of lactation, the level of prolactin is very high. It's very high. So the high level of prolactin can give negative feedback to anterior pituitary that the anterior pituitary will not release LH and FSH, and hence there will be no menstrual cycle. Fine. It's also a mechanism where one baby, first baby, is giving inhibition to the mother not to have another baby. Okay. The baby itself is inhibiting mother that I don't want another child, first look at me, give me the entire milk, right. It's kind of a nature, right. Nature works very nicely. So here, sometime if her hormone level got dropped and a couple undergo sexual intercourse and there has ovulation taken place, because you never know when ovulation will take place, it will not lead to any sign or symptoms, right. So the couple has done intercourse, the prolactin is lower, inhibition has broken down, ovulation has taken place, the second child is on the way, right. So this is how lactational amenorrhea can be a failure, because hormone levels, you never know when they are up and when they are down. Okay. So what happened in lactational amenorrhea? There is period of, or during lactation, in which lactation? Intense lactation, which is around first 6 months post delivery, that means after delivery of baby. The prolactin is higher and inhibit follicular growth and ovulation. Okay, now what's the problem? The level of hormone changes suddenly. That's a problem, and when that suddenly changes, that will lead to the ovulation and hence the new baby, right? Alright. Now, that was about the natural method, where we have seen periodic abstinence, coitus interruptus and even lactational amenorrhea. They are not going to be a very reliable method, and if you are relying on them, maybe I think you should use another method, and which is the best method nowadays is a barrier method. What is a barrier? Barrier is something just like a wall which will prevent meeting of two people, two substances, two cells or anything, right. So barrier will prevent meeting of sperm and ova. Alright, let's see. So here we are using some materials and devices. Now how? Like I give you example, the first one is condom. Condoms are usually, you can see in the advertisement a lot nowadays. Okay. The condoms, they are available for both male as well as for females. Even a man can use it, even a female can use it. But the most common that we know, a normal person know, is a male condom. Okay. Now, what's the difference between two? The male condom looks just like this, the first one. It has a ring here, and this is how it looks when it is not opened. When you open it, it looks like this, and it has a nipple like structure here. Okay. This is usually made up of latex rubber. It is made up of latex rubber. Whereas a female condom, it has two rings. You can see one ring is here, another ring is here, right. The male condom is made up of latex, this one is made up of polyurethane. The male condom have one ring and that is open, here it is closed, and it is usually worn on the penis. Imagine this is the penis of a male, and this is how a person wear the condom, a male wear a condom. In female, there are two rings. The inner ring is usually closed. Inner ring is closed. And this is the outer ring. Outer ring is open. Outer ring is open. And this female condom is usually inserted inside the vagina. For example, this portion is cervix and this is vagina. This is vaginal opening like this. Okay. So here near the cervix, here we have cervix, here we have uterus, and this is how it is inserted inside the vagina. And during sexual intercourse, the penis will go inside the condom, it will not touch the wall of the vagina. Okay. Just like if a male wear the condom and female is not wearing condom, the male penis will not touch the female's vaginal wall, because we have wrapped the penis with the condom, and also whatever semen male will ejaculate, it will remain inside the condom only, fine. Whereas in this one, this is inserted inside the female's vagina, and here whatever ejaculation male will do, it will be collected in the condom and later on it can be removed. Okay, so these two methods are very easy to use. They are easy to use, that give privacy to a couple. You don't have to go to the doctor to use them. Fine. And these one are disposable and then you throw it, you don't use it again. Fine. So the difference is male condom is made up of latex. Female condom is made up of polyurethane. Polyurethane. Second, male condom have one ring. Female condom have two rings, in which the inner ring is closed and outer ring is, yes, open. Another, male condom, it is usually used on the penis, or they wear on the penis, and this one inserted inside vagina. Since both, if we use any of them, if a female, either a female can use it, even a male can use it, right? Anyone, out of couple, anyone can use it. So if they're using it, anyhow the genitals will not touch each other. If we are using the male condom, then the penis will not touch vaginal wall, right? If a female is using this female condom, also known as fem shield. What is its another name? Fem shield. We also call it as fem shield, right? If female is using it, then the vaginal wall will not come in direct contact with the penis. In any case, because both the genitals are not touching each other, the chances of STD will be least. So we say these condoms, they prevent STDs because genitals do not come in contact. When genital and the fluid from the genital come in contact with each other, then the STD take place. For example, if a male have HIV, its semen will have the HIV virus, and that semen, if touches the female vaginal wall, that virus from vaginal wall will go inside a female, and female will also get the HIV. Right, AIDS. Fine guys, so this is how it prevents STD. So condom, whether it is a male or a female, prevents STDs. How? Because the genitals and fluid does not come in contact. Okay, now the government has launched the male condom with the name Nirodh, and it is usually given at a ₹1 rate or even free somewhere, and to just make people more aware about use of these barrier method, because they are very cheap, they are reliable, they are easy to use, right, and they are disposable also. Once used you can throw it. So also they are preventing STD. That's the main thing why government promote this, because people who undergo sexual intercourse with multiple partner and unknown partner, for them this is the best thing to prevent themselves from sexually transmitted diseases. Fine. Okay, so that's about the condoms and barrier method. We have another barrier method, that are diaphragm and volts, and second is cervical cap. They are also barrier method, but they are little different. See, this is diaphragm, volt, both look like that, the difference is in the size, and this is a cervical cap, right? How cervical cap is different from the diaphragm? First of all, the diaphragm is dome shaped, right? You can see hemispherical dome shape. The cervical cap have this nipple like structure. It has this nipple like structure. The shape is different because of their location, right? How? Let's see. The diaphragm, they are hemispherical dome shaped. Hemispherical dome shape. So how are they generally applied? Let me show you with the diagram. If this is a uterus, this is the cervix, and this is a vagina. This is how our bodies, females' bodies. This is cervix, this is vagina. Okay, so diaphragm, the small hemispherical cap-like structure, is usually inserted here like this. It is usually inserted here like this. Okay, what about the cervical cap? if imagine this is the uterus, this is the cervix, this is the vagina. Okay. In cervical cap, the cervix nipple usually get inserted in the cervix, and this structure comes out here somewhere. The reason is this nipple structure will create suction and it will not move from its place, which is not in the case of the diaphragms. Okay. So, the purpose of this nipple shaped structure is it creates suction. It creates suction. So, this one is inserted in vagina near the cervix and this one is inserted in the cervix. That is why its name is cervical cap, inserted in cervix, and both are made up of rubber. What are they made up of? Rubber. They are inserted in vagina near cervix. That is a difference. Okay. So, what do you think? Do they prevent the STDs, or can they prevent STDs? Think about it. It is very simple. If someone is using cervical cap and diaphragm or valves, can they prevent the STDs? The answer is no, because they are not completely covering the vagina, they are only covering the entry of the cervix or the uterus, so that the semen will not reach the fallopian tube. Sperm should not reach the fallopian tube, but since they are not covering the complete vagina, the semen will definitely get deposited somewhere here. It will be prevented to move upward, it will be deposited somewhere here. So, it is coming in contact with vaginal wall, so it will not prevent STD. STD will only be prevented by only one method that we have so far, is the condom, whether it is a male condom or it is a female condom. Fine. Okay. Next method is the chemical method. Now, what are chemical methods? Since it is said that some condoms have a success rate of 80%, some have a success rate of 90%, some have 92%, no condom have a success rate of 100%. Even some people, while using the proper condom, they can get pregnant. Because the success rate is not 100%, you never know which sperm is so fastest, has penetrated through condom and went upward, right? It can happen. So, some couple, they also use some chemical method along with the barrier method. What are these chemical method? So, before the sexual intercourse or after the sexual intercourse, there are certain chemicals that can be inserted or applied in the female's vagina, so that if there is any somehow sperm present, or if any somehow the sperm is coming to its way, then that sperm can easily be killed. So, there are certain chemicals which are spermicidal, which kills the sperm. They are used in the female's vagina before or after copulation. They can be used along with barrier method also, they can be used alone also. So, in chemicals, we have certain chemicals which are spermicidal. That means that will kill sperm. Spermicidal chemicals are used along with barrier method. Okay, so they come in the form of cream, sponge, foam, and even jellies. Like example, I am writing example of them. Like there is a jelly named Perceptin. It can be, you can buy that in over the counter, right? Like in foam, we have aerosol foam. Just the thing is, chemicals are almost similar. They are present in different way. It's a jelly like, it's a cream like, whatsoever consistency they like, right? In the cream like, we have Delphin. In sponge, we have like Today. Okay, so all these, they contain chemicals like citric acid, boric acid, right, and some other KMNO4 and so, right. All these chemicals, they can easily kill the sperm, and they are, where they are applied, these chemicals are applied in vagina, applied in vagina. Okay. So they will ensure that no sperm is left in the vagina and that will not be able to reach up, right? Because the fastest sperm, the healthiest sperm will somehow reach the fallopian tube, and if there is ovum, will lead to surprise, right? Okay, next are your intrauterine devices, another important device for contraception. Intra means inside, uterine means uterus, and device is device. It is known as intrauterine device because it is inserted inside uterus, simple. So they are inserted inside uterus. Now we are going or moving up to uterus, so we need a doctor for that. Up to vagina there is easily accessible, and a person can use any diaphragm, vault, cervical cap, condom themselves. But now it's a question for uterus. Now these intrauterine devices, if anyone has to use, they definitely have to go to doctor or a nurse. So they are inserted inside the uterus with the help of doctor or nurse. Now the question is, ma'am, we understand this is an intrauterine device, right? This is known as copper T. Its name is copper T. Ma'am, it is T shape, but how it is inserted in the uterus? Uterus has a very small opening, the cervix. How will you insert this T shape? It will be very difficult. See, this is open IUD. When IUD is needed to be inserted, this is in this shape like this. So it can easily enter inside the uterus. So, and after it gets inside uterus, this string is pulled down and it get into this T shaped, right? So this is how it is inserted inside the uterus by the doctor. So the main function of the IUD is that it increases phagocytosis of sperm. It increases phagocytosis of sperm. The uterus is a very nice organ of a female, right? It has a property of phagocytosis. Uterus itself, it has a lot of immune cells in it. They can do the phagocytosis. For example, during insemination also, only one sperm reaches the ovum. Other dead sperms, what happened to them? The uterus will absorb it and immune cell will eat them. So there is a thing, if any foreign substance, any substance, like sperm is also foreign, right? Any foreign substance, if it enters inside the uterus, the immune system will get triggered. An immune system will start acting in a weird manner, like a virus enters in your body and it will start doing phagocytosis, like macrophages does phagocytosis. We have a lot of macrophages in the uterus. Imagine this is a uterus. If in the uterus any X thing come which is external, not of a female's body, like sperm, even like copper T, the phagocytic cells like macrophages, they will get activated and they will killing it. Now this T-shaped structure, it can be made up of anything. So this T-shaped structure, if it is made up of anything, enter inside uterus, it's a foreign structure. These macrophages, they will get activated. They will working in a weird manner. The immune system will enhance, and when the sperm will enter, the sperm will not get any opportunity, and the sperms, they will be directly killed by these macrophages. So this is how we say, if there is any IUD, any X IUD, say it copper T, say it inert IUD, I will tell you the different types also. All IUD do one important thing, common thing, they can increase phagocytosis of sperm. Why? IUD is foreign object. And foreign object increase the immune system and activate macrophages or immune cells, right? So immune cells are now ready. If sperm will come, they will kill it, eat it. Now let's see the various types of IUD. IUD are of three types. One is inert or non-medicated. We are not using any medication in it. Second is copper containing, it contains copper. And third is hormonal. Third is hormonal, right? There are three types of IUD, inert or non-medicated, where we are not using any medication, we are not using any substance. The only thing it can be made up of is either barium sulfate plus steel. So it will not be having any medication or all, it's just a foreign object blocking the sperms to move up and also doing the phagocytosis. So the example of the inert IUD is Lepes loop. So Lepes loop is one IUD present over the counter and it's inert, contain no medication. So its chances of side effects will be less, but it is least reliable out of these if we talk about the pregnancy. Okay, now copper containing, it contains copper. Now what's the role of copper? These copper ion, they have a role, they will suppress the sperm motility. Sperm is healthy if it has two things. One, proper shape and size. We have said na 200 to 300 million sperms are present in semen per ejaculation. Out of that 60% should have proper shape and out of that 40% should have vigorous motility. If it does not have proper shape, it has motility, it will run but it will not be able to penetrate ova because the shape is not proper. If it has proper shape but it cannot run, then it will not be able to reach to the ovum and hence not successful. So motility is one such thing that is very important for sperm to reach the ova. What if we suppress the motility? How? The copper ion will suppress the process of its motility and hence it will not be able to run towards the ovum. This is how copper containing IUDs work, right? You can find them under the name copper T, copper 7 or multi-load 375. These are the examples. Okay, what about hormonal one? Hormonal one contains analog of progesterone. What is analog? Analog means progesterone-like. Progesterone-like. They contains actually hormones. For example, if this is a copper T, it has copper impregnated on it, right? If it is a hormonal, it will be having hormones in it and it will be releasing small amount of hormone all the way. Fine. Now, moving further. If it is hormonal, it is releasing hormone called progesterone, then how it will prevent the conception? If you remember the menstrual cycle, do you remember that? See, if you remember menstrual cycle, this chapter will be very easy for you. Okay, so I will suggest all of you to go back, watch my human reproduction menstrual cycle chapter and then start doing the reproductive health contraceptions. Okay, this is 14 day, this is first day, 5th day, 21 day, 29 day. 14 day, now you all know it is the day of ovulation. After ovulation, what happened? Corpus luteum is formed. The level of progesterone is lower throughout this phase of cycle, but it gets higher at 21st day and then drops. It gets higher at 21st day and then it drops gradually. This is what we have done so far. This is how progesterone peak is. Now, in this phase called luteal phase, you cannot develop any follicle. Follicles are always developed in the first 14 days of a cycle. You cannot develop any follicle in the luteal phase because the level of progesterone is higher. And progesterone has a thing that it inhibits LH and FSH both. Progesterone has a thing, it will inhibit LH and FSH both. Okay, let me explain you in more detail. We have hypothalamus. Yes, hypothalamus secrete hormone GnRH. GnRH goes to which pituitary? Anterior pituitary. Anterior pituitary secrete two hormone FSH and LH. FSH, what does FSH do? Growth of follicle. And what does LH do? Ovulation. And after ovulation, what is formed? Corpus luteum. And after corpus luteum, what is released? Progesterone. And progesterone, it gives negative feedback. It gives negative feedback to anterior pituitary that please do not release FSH and LH. If there is no FSH and LH, there will be no follicle growth and there will be no ovulation. Simple. So what we are doing is, we are maintaining luteal phase in a female. We are maintaining luteal phase in a female where progesterone level will be higher. If I am eating progesterone for the entire 31 day of a cycle, my progesterone will be higher throughout. Yes, if I have for throughout the cycle higher level of progesterone, no follicles will be developed. In this phase, the follicles are developing because the level of progesterone is lower. Here the follicles are not developing because the level of progesterone is higher, because progesterone give negative feedback for FSH, right. So here in the hormonal IUD, we are giving analog of progesterone which works like progesterone. So what it will do? It will prevent ovulation. That means no follicle growth, no ovulation, no pregnancy. That's it, right. Second thing, progesterone also do one more thing. It thickens the cervix. How? That means cervix, if you remember cervix, this is uterus, this is cervix. The cervix have cervical glands, it has cervical glands, these are cervical gland. Cervical glands secrete cervical mucus. Progesterone makes the mucus thicker. If I am giving progesterone for entire cycle, the cervical mucus will be so thick, it will produce a plug hair, right, thick mucus. And mucus is thicker only due to progesterone. So if someone is taking progesterone for 30 days, the viscosity of the mucus is very less, it will become very thick. So if a sperm is coming here, will it be able to reach? No. So cervix will also be very active, producing a lot of mucus, thick mucus. As a result, cervical mucus get thickened and no sperm can enter inside uterus. That's the second function of it. So it thickens cervical mucus, preventing entry of sperm. Now very important point, it alters the nature of endometrium to prevent implantation. What is implantation? Fixing of the blastocyst inside the uterine wall, right. When a normal natural progesterone comes, endometrium get thickened, get ready for implantation, blastocyst get impeded on it, normal pregnancy goes on. But if we are giving analog of progesterone, it is different from progesterone. Now endometrium that now will be formed is not suitable for embryo to get implanted, and hence implantation will not occur. If we will compare the endometrium which is formed due to the action of natural progesterone and which is formed due to analog of progesterone, both are different. The one which is maintained due to natural progesterone is more good for implantation. It is compatible with the embryo, and embryo can easily go and apply. But the one which is the one endometrium which is maintained due to analog of progesterone, that one is not good enough for embryo to get implantation. Hence when the embryo will try to implant, the embryo will not be able to implant it, right. So because it is also preventing implantation, it can also be used as emergency contraceptive. You must have heard of I-pill. I-pill work the similar way. Even if someone has done sexual intercourse and you think, yeah, fertilization may have taken place. So if you will eat that pill within 72 hours of sexual intercourse, then endometrium will be altered. It will not be suitable for implantation. Even if the embryo has been formed, it will not get implanted on the uterine wall, and hence you can prevent the unwanted pregnancy. This is how it will prevent emergency contraception, right? Imagine today if a couple undergoes sexual intercourse and they are sure the baby will be formed, they will go to doctor. Either they will take a pill which contain the analog of progesterone, or they can also have this hormonal IUD inserted in the uterus, but within 72 hours. Now analog of progesterone will keep on releasing, it will alter the nature of endometrium, and hence even if the embryo is formed, it will not get implanted into the uterus, right. So what is the name of or the example of them? We have LNG20, levonorgestrel. That's a chemical which is just like progesterone, and we also have one more, Progestacert. These are the examples of hormonal IUDs. Okay, so this is how 3 type of IUDs are available, and all are working for one goal, preventing conception, but their function is different. This one is just phagocytosis. This one, phagocytosis plus suppresses the sperm motility, but main function is sperm motility here. And this one, the main function is preventing ovulation, thickening the cervical mucus, and also changing the nature of endometrium so that implantation will not take place, and hence it can also be used as emergency contraceptive. Fine. Okay, that's about the IUDs. Let's move further and talk about oral pills. Pills, medicines, tablets, right? What are pills? Tablet. 2 type of tablets are available. One is steroidal, another is non-steroidal. Okay, let's talk about steroidal first. A female has to eat tablet now, right? Imagine if I say, if I am taking hormonal IUD, hormone is released from IUD but it's in the uterus. What if I take the same hormone but through oral route, through my mouth? The result will be same, just the route will be different. If a female is not comfortable in using hormonal IUD, she don't want anything to get inserted for longer time in her uterus, she can go for pills. They are easily accessible method. What you have to do is you just have to eat tablet every day or in some days. Okay, so what in the steroidal pills? Steroidal pills are of 2 types. One are mini pills, another are combination pills. Okay, so the choice of these pills is that both will contain progesterone. This one may contain progesterone and estrogen combination. This pill will contain progesterone. They are progesterone only pills. And this one, combination pill. Why it's combination? Because it will contain the combination of estrogen plus progesterone. Okay, sometime you will also hear the word estradiol. So estradiol is also estrogen. Estradiol. Okay, and you may also hear the word progesterone, Progestacert. I will write it later. Okay, now both are having steroid. What are steroid? They are lipid like, and they are these all hormone, testosterone, progesterone, estrogen, they all are steroid hormones because they are made up of steroid, which are lipid like molecule. Okay, now the difference in this pill is, first difference, they are contain only progesterone. They contain estrogen and progesterone both. The choice is on the basis of if one want menses or not. If a female need a period of menstrual bleeding to keep on feeling that my body is normal and I am a female, my femaleness should not be gone, because a female does not get menstruation, she don't feel like good, right? So if a female does not want menses period of 1st to 5 day cycle, right, in 1st to 5 day of menstrual cycle a female get menstruation, right? If she don't want the menstruation, for her if it is very bad, very painful also, then she can opt for this mini pills. What do these mini pills do? You have to eat for entire month. You have to eat for entire month, right? How they will work? Let me show you. If this is your menstrual cycle, this is 14 day, first day, 5 day, 29 day, right? So what we do, if a female is on mini pills, the level of progesterone will be higher for entire first to 29 day of cycle, inhibiting the anterior pituitary, no FSH, no LH, prevent the ovulation, just like hormones in IUD were doing. Okay, so here the level of progesterone will be higher for throughout the cycle, right? That means even if it is the higher phase, she will be have higher progesterone for entire cycle. When she is on which pill? Mini pill. So in mini pill, she will not get menstruation at any phase because progesterone is there, and progesterone will keep on maintaining endometrium. When progesterone goes down, endometrium sheds, right? When she is on combination pill, we give combination pill in a different way. How? In the first 5 days, the female is supposed to have taking the medicine, right? The doctors say you can have medicine on the first day of your menstrual cycle, right? And we will gradually build up the level of progesterone. After that, the level of progesterone will be quite higher, and around here someday the female is supposed to leave the medicine, right? You got it? It is said that female should start taking the medicine on first day of her menstrual cycle, and we gradually build up the level of progesterone. The progesterone got higher around 5th day of the menstrual cycle, and then she keep on eating the medicine in higher amount, and then again she is asked to reduce the amount, and then the medicine she will quit eating the medicine, and the progesterone level will drop. This is how she eats the combination pill. So technically, in short term, if I say this pill is taken for 30 days for the entire cycle, you don't have to leave it in 1 month, right? For example, if someone start on mini pills, she has to take contraception for 6 months, she will eat for entire 6 months. In combination pill, it is taken for 21 days. She will only eat for 21 days. Imagine this is the 21st day and she started her pill on first day of the menstrual cycle. She got menstruation today and she start eating the pill now. Okay, she'll get the menstruation for 3 days and the level of progesterone will get higher. And now the level of her progesterone is higher for entire cycle, preventing the ovulation. And now around 21st day, she will quit eating the medicine and the level of hormone will reduce. And here, why the level is reducing? Why are we reducing the level? So that there should be no menstruation. So technically, this pill is eaten for entire month. This is taken for 21 days. For 21 days. Usually, first tablet is eaten on first to 5 days of menstruation. Okay, so it is usually said for the next cycle. First tablet means for the next cycle. You will eat for around in the day of menstruation, and then it is left for menstruation. Why do we quit eating it? So that the whatever days are left out, like if the cycle is 28 days, 7 to 8 days, whatever these days are, they are left for menstruation, so that the level should drop gradually, and then when the level drops gradually, endometrium will shed off. So this is how all these 7 to 8 days are for menstruation. Okay, cool enough. So this is how steroidal pills work. But what is the inner sense, how they prevent conception, is same as hormones. How? When you have higher level of progesterone, what progesterone will do? Whenever you have higher level of progesterone, progesterone will inhibit ovulation. Whether you are eating mini pill or combination pill, it will prevent ovulation. What second thing it will do? It will thicken the mucus. Which mucus? Cervical mucus. So by that, no sperm can enter inside the uterus. And third thing, what is that third thing? The third thing is it can act as emergency contraceptive also. Why? How? It alters endometrium nature. Okay, if the level of progesterone, how is the normal level of progesterone? Normal level of progesterone is like that. Lower progesterone, higher at 21st days and then drop. This is how it is. How in combination pill? You are eating on the first day, the level will increase, and for throughout the cycle it is higher and then it drops around after 21 days. In mini pill it is always higher. Cool enough? Okay. So another type of pill we have is non-steroidal pill. We are eating a lot of steroid that may give side effect to a female's body. So there was a need to produce a non-steroidal pill which will not contain any steroid. So there was a need to produce that. So India came up with Saheli. Saheli was the first non-steroidal contraceptive pill which was produced by CDRI Lucknow, Central Drug Research Institute. All these pills we are eating progesterone, inhibiting ovulation directly. But in this one, we are not targeting the level of estrogen. We are targeting at the place where estrogen works. So we are using this drug which is estrogen receptor modulator. It's a very smart drug. How? Okay, listen to me very carefully. I am explaining you that in detail. What happens in our body? Estrogen go to anterior pituitary. When estrogen is at high amount, it goes to anterior pituitary. Okay, imagine this is anterior pituitary. This is a cell of anterior pituitary. How will estrogen go to it? Estrogen will talk to its receptor. This is receptor. Okay, estrogen will bind to its receptor. This is estrogen. And after that, once estrogen binds to its receptor, then the function of nucleus will change, the function of DNA will change, and this cell of anterior pituitary will produce LH. And LH will do ovulation. This is how it works. So every hormone have its particular receptor on its target cell. With the help of that hormone works. If I say I have modulated this receptor, I have changed the receptor, I have destroyed the receptor. Okay, will this estrogen be able to bind? No. And will this cell will get to know the information? No. Will this cell produce LH? No. Will there be ovulation? No. So we rather giving estrogen or progesterone than inhibiting the LH synthesis, why not to modulate the receptor? So this is what this drug does. In the steroidal one, what happened in steroidal one? We give progesterone. Progesterone go to pituitary and inhibit it directly and no LH is there. But in the non-steroidal one, what we do, we are modulating this receptor so that estrogen cannot bind to it and hence it will not produce LH and hence no ovulation. So this is how we say this pill is estrogen receptor modulator, and this is not eaten for the entire month just like this. It's once in a week pill. You have to take just one pill in 1 week. So it's also easy for the female. She don't have to eat a lot of tablet, because when you eat tablet you feel like you are very tired, you are sick, fine. So the dependence of pills also will be less. So this is how the pills can also be an alternative for contraception. But nowadays female has reduced taking the pills. The most commonly used are IUDs and the second one is condoms. Okay. Alright, so moving further to injectables and implants. So next we have is injectables and implant. In injectables, the injections are given. What are given? Injections. Again, these injections are of progesterone. See, the medium is different, but the product that we are giving is same. Now, they are all, the injection they are given, they are of progesterone like material, like we have Progestasert, right? We have example of it like Depot-Medroxy, Depot-Medroxy, Progesterone acetate. The short form is DMPA. So, this is some chemical that is given, and this one injection runs for around 3 months. So, slowly all this progesterone will be utilized in the body and prevent the ovulation. Similarly, if you do not want injections, you can go for implant. What are these implants? They are silicone cylinders. Silicone cylinder. Now, this is not a cylinder like a gas cylinder. These are cylindrical like matchstick. They are very thin like matchstick, right? So, these are silicone cylinders. They are applied under the skin, right? Silicone cylinder, they are inserted subcutaneously, and the insertion is very simple. You do not need to do any operation or something, just a small suture and they are inserted here, either in the forearm or on the upper arm. They are usually said that use it and forget it. So, usually females they use them and they get inserted in this portion of the arm. So, they are of two type. One is Norplant and second one is Implanon. They are of two type. So, again the choice is yours. Either you have 6 cylinders in which one cylinder will contain 36 milligram of LNG 20 levonorgestrel. The same we have done in the IUD, the same material is there. Okay, the only thing is route is different. In this you are using the cylinder inserted in the skin. In this you are taking injection. In oral pills you are eating the progesterone. In IUD you are putting it in the uterus, but the function and the product is same. Or we can go for Implanon. It's one cylinder only of 150 milligram contain again progesterone, but the chemical name is little different, that is 3-keto desoergestrol. The same thing is this is also progesterone like, this is also progesterone like, but the chemical is little different, working is just progesterone like, fine. Now, this one run for around 5 years in the body and this one for around 3 years. So, that is what is said, use it and forget it, because for 5 years you are having this chance, no chance of pregnancy, right. So, usually people who already have children, they do not want another children, they usually, the females, they usually use this one. Up till now only condoms were the one in which male had a role, right. In natural one, coitus interruptus, male had a role, otherwise eating hormone is the work of female, okay, because we are controlling female cycle. Alright, next is your surgical method. Surgical method is also known as terminal method. Terminal method of sterilization, or simply it can also be known as sterilization method. Since the word sterilization has been used, so you get a better understanding, the person is going to get sterile. The person is going to get sterile. Either male or female, they both can undergo the surgical method where they get sterile. Later on they will not be able to have baby. So, they are of two types, the surgical method. One is for male, that is vasectomy, and other is for females, that is tubectomy. Most of you get confused here which one is for male, which is one for female. Let me simplify this for you. Ectomy means surgical removal. Ectomy means surgical removal. Vas word comes from vas deferens. We are doing surgery on vas deferens. Here we are doing surgery on fallopian tubes. On what fallopian tube? So, what we really do in this? Imagine this is a male reproductive system. In male reproductive system, the sperms are produced in the testes, and from testes they run through these duct system like vas deferens, which move out from the scrotum, enter the abdomen, and go into this portion and moves out. What if we block the passage in between? The sperm will not be able to reach in this portion, right? Yes. Similarly, the ova is produced in the ovary, released in the fallopian tube. In the ampulla, sperm will reach and do fertilization. What if I also block the entry of ova here by cutting the fallopian tube? So what we do in this, we do a surgery. We cut vas deferens in the males, or we can cut fallopian tubes in the female. By that we are blocking the transport of sperm. We are not blocking the synthesis of a sperm or ova. We are blocking the transport of a sperm. In female, the ovary will keep on producing ova, but it will only reach up to this level and not move further. In male, the male will produce sperm, it will move only up to this level and not move further. But in male, the number of sperm will reduce, right? Why? Because whenever there is accumulation of sperm, if they are not withdrawn, then testes get a negative feedback from Sertoli cell and testes quit producing more sperm. In female, proper menstrual cycle will work because we are not inhibiting any hormones. Ovary will work properly. Ovary will have proper FSH, grow the follicle, do ovulation and maintaining the endometrium via hormones, and she will also bleed. The only thing we are doing is we are cutting here so that ova will not move further. Fine. Similarly, in males, sperm will be produced, Leydig cells are normal, they will produce testosterone, male will have proper testosterone. If he has proper testosterone, he will have proper sexual desire or libido. Same in case of female, because she has hormone, she will also have proper sexual desire. Male will have proper erection. Erection has nothing to do with the vas deferens or transport of sperm. Erection occurs due to brain, due to sexual desire, due to hormone testosterone. Okay. And second thing, semen will also come out, but without sperm. Now what semen is made up of? It is not just made up of sperms. It is made up of the glandular secretion of all the three glands: prostate, seminal vesicle, bulbourethral. So male will also produce the semen, but it will not contain any sperm. Why? Because here the transport of sperm and here the transport of ova has been inhibited. Right? So in a way everything will be fine. But why it's sterilization? Because once you have cut the vas deferens, there is no moving back. How will you take another piece of vas deferens and then put it again? No. What we do here is we are making two cuts. Like this is any pipe. I am doing two cuts here, and now pipe is just like that. The middle portion is somehow missing. So this is a permanent method. Once you have done it, you will not be able to get fertile again. That is why it is a sterilization method. It is irreversible method. There is no moving back. That is why this is not the ideal contraceptive. These methods are usually adopted by people after they have the desirable number of children. Like they had two children, they don't want another. So any of the couple can undergo this method because they don't want it anymore. Right? So what we do in this method? Yes, in vasectomy, the vas deferens is cut and two ends are ligated separately. So what happened in this one? It will block the transport of sperm. The sperms will be produced, but it will block the transport. Second thing is that male will have proper libido or sexual desire is not affected, Why? Because it is producing proper hormone. Semen is produced without sperms. It will be there, white semen will be there, but sperms will not be there, right? In case of tubectomy, the fallopian tubes, which tubes? Oviducts or fallopian tubes, they are cut and ligated. What it will do? Block the transport of ova. She will also have proper sexual desire. Proper sexual desire and menstruation, because no hormone is affected. So here the only purpose of the surgical method is that it is just blocking the transport of sperm. No hormones are affected here. But another point that I have told you, this method is irreversible. Irreversible method. Okay, you cannot move back if you want to be fertile again. No chances of that. Okay, so that's about the various methods of contraception. I hope you have understood it really well. Why not to check how much have you understood? So let's get started with first question, which is match the following. So in first column we have Saheli, condoms, multi-load 375, implant. In column 2, suppress sperm motility and fertilizing capacity of sperm. Cylinders containing progesterone applied under the skin. Prevent the entry of semen into the female reproductive tract. Non-steroidal preparation. So first of all, Saheli is a non-steroidal preparation. I think there is no doubt in that. Condoms are the one that prevents the entry of semen into female reproductive tract. It's a kind of a barrier. So for B we have 3. Multi-load is a copper T which will suppress the sperm motility and hence sperm will not be able to fertilize the ova. So for C we have 1. And implant, they are cylinders of progesterone which are applied subcutaneously. Cutaneous means skin, right? Under the skin, sub means under. So for A we have 4, B 3, C 1 and D 2. I think for A we have 4, for B we have 3, C 1, D 2, answer is 3. Okay, next. Which of the following contraceptive method prevents ovulation? Okay, first of all, make your mind clear. Which method can prevent ovulation? That have hormone. That have hormone which is progesterone like. Okay, so copper T does not have hormone, it has copper, so this is not the option. Mini pill is oral pill, it contains progesterone, so it's a good option. Norplant is implant, it also contains hormone, so it will also prevent ovulation. LNG20 is itself the hormone. It can be present in your injections, it can be present in implants, it can be present in your IUDs, it can be present in your oral pills. And diaphragm is a barrier method. So C, E and B. B, C and E, answer is 2. Cool enough. So these kind of questions will be there. So for that you need to have a segregation in your mind, what method is which and which one will do what, right? For example, let me give you a quick revision, how to remember things. Like, first of all, remember in this way, natural method. In natural method we have first periodic abstinence, coitus interruptus, lactational amenorrhea. All these are based on hormones, not eating hormones, but hormones are involved. Okay, not using anything, least reliable. Then we have barrier method. In barrier method, what we have studied so far, we have studied condoms, male, female both, diaphragm, vaults, cervical caps. What's the role? All are preventing the meeting of the sperm, right? Condoms prevent STDs also. Then after that, which method we have done? Chemical method, which is done along with the barrier only. Okay. Then we have done IUD, suppress the or do the phagocytosis of sperm. We have inert, the name is Lippis loop. We have copper containing, suppress the motility. Then we have hormonal, work just like hormone, LNG20. Okay, we are taking hormone but in form of IUD. Then we have oral pill. We are eating pill, again contain hormone. The hormone can be, if we have steroidal one, okay, then it can be just progesterone, progesterone only pill or combination pill, or non-steroidal can also be the option, but that is Saheli. Then we have implant. In implant we also taking hormone but in the form of implanon and norplant. So if you have this kind of segregation in your brain, and then you will never ever get confused in the contraceptions. Okay, all right, let's move further and do another question. Lactational amenorrhea is a natural method of contraception. It is due to the high level of FSH/LH, estrogen, prolactin, progesterone. Lactation, which hormone is higher in lactation? Prolactin, and that is the hormone which is inhibiting FSH and LH. So prolactin is the king here. That's the hero here. Okay. Next. Saheli, a weekly oral contraceptive, can be best described as progesterone antagonistic. Progesterone antagonistic means that work opposite to progesterone. Antagonistic means opposite. Non-steroidal preparation, true. Ovulation inhibitor, no. It is estrogen receptor modulator. It is not directly inhibiting the ovulation. It is done by progesterone. Affecting the nature of cervical mucus, this is also done by your progesterone. So it is non-steroidal preparation, very true. Next. Choose a pair of birth control method with maximum and minimum failure rate. You know who has maximum failure rate? Where we are not using anything. Hit and trial, natural method. So find the natural method first. Periodic abstinence is natural method. Coitus interruptus is natural. Condom is barrier. IUD is not the one which is natural. Okay. So out of these two can be the answer. Now with minimum failure rate, which is the one that leads to sterility, that is the surgical method. Tubal ligation, fallopian tube ligation, that is surgical. So answer to this question will be third. Okay, maximum and minimum respectively. Most of you also do the question incorrect. Sometime what they do, they have given the option, another option where they have written tubal ligation and coitus interruptus. Now you must be thinking, ma'am, it's okay, it is just written here and there. No, when they have given you respectively, you have to choose maximum first, minimum later. Okay, next. Thank you. So that's it about all the contraceptive methods. I hope you will do it really very well. And the homework is that you have to read the NCERT, but first learn the contraceptive method. This is a huge graph, or you can say it's a table like form. Okay, make a table of all the contraceptive, write how everything works. Like I made here this one. This will segregate the contraceptives in your mind, and you will be able to, you will be better able to understand them, and you will be able to learn them for your entire life. Do make notes, and after making notes, make a chart of it and write shortcut things like what happened in periodic abstinence, not practicing sexual intercourse, which day 10 to 17. Just write a pointers. Just write a pointers. Okay, we are writing in elaborated manner in notes because most of you must be preparing for boards as well. Those who are preparing for NEET, try making short notes along with that. Okay, so I hope now you got to know how to control the birth. You can also give this information to any person, any relative, anyone who needs the information, who needs the knowledge, but don't give it to very elder people who doesn't want it, and rather maybe they will get offended. Fine. So I'll meet in the next class. Till then, keep on studying very hard, and bye bye, take care.